sports medicine as a department is a father of modern exercise medicine, and it's a highly evolved and developed subject. How serious is a given sports, and is sports a serious matter? This is something which each child who aspires to be a sports person should hear. Just not that, but the parents also should understand that sports is a serious matter. It's serious in two ways. One, it has a potential to give you a lot of glory, where you can give a lot of state level importance, national importance for yourself, as well as a stage that is set on the world. Gives a lot of chance of getting a glory. But equally important is that it can also cause injuries. So can injury happen to me? That is a question that people have to understand. Can injury happen? And most of the people are of the feeling that I may not get injury and I am out and I am not someone who will get injury. That's a very wrong concept. Anyone who is into serious sports will get injuries. My father was the national volleyball coach, and he was the coach for the services team for almost 25 to 28 years. And throughout my childhood, I had seen top level athletes getting injuries, starting athletes getting injuries, and just getting out of the whole career is gone with that. Time has changed from 1990s to today 2023. We are able to get back people into sport in a much easier fashion with a proper rehabilitation and a surgery. We are proud to say that Indian hockey team has many players who have undergone ACL and multi-ligamentous injuries and injuries of shoulders who have got back into the national team, and they have played and have been instrumental in even getting a bronze medal in the last Olympics. So what am I trying to tell you youngsters today is consider sport, and it has to be very important that you are disciplined. The most important thing is you have to be disciplined, and your awareness should be good about different injuries. Injuries can happen to knees, injuries can happen to ankle, and today we have in fact subdivided all the sports injuries into some things like, for example, if you are a bowler, the shoulder injuries are very common. Whereas if you are a badminton player, the commonest injuries will be an ankle sprain and a knee problem, and also a shoulder injuries. Now, Indian people always have certain issues with their diet, and these diet related issues are also to be sorted out here. So the basics of all injury prevention starts from three things: whether you sleep right, whether your diet is right, and whether you are exercising right. So sleep, exercise and diet, these are the three cardinals. Sleeping for 7 to 8 hours has been said to be the greatest thing to prevent sports injuries, which people don't consider as important. Second would be you should not be nutritionally deficient, and we see it extremely large number in India. To just say the thing that we find much more injuries in players coming from the northeast region than when we see people coming from the northwest region. Northwest region being more affluent, rich people, more consumption of milk and related products are there. The amount of injuries as they become adult is lesser than those who are from the northeast, from a more deprived society. So sleep, diet, and third one would be discipline in understanding exercises. And understanding exercises, again, it's a topic in itself separate, and we would be putting in this channel itself how to prevent and the basics of sports injuries. And as we finish the basics of sports injuries, follows on this channel itself, so that you understand sports injury prevention of individual region, so that anyone interested into serious sports take their body seriously, take care of it properly.